Hi, my name is Dr. Barton. I'm with the Oregon Trail Veterinary Clinic, and today we'd like to visit with you about pilling your dog. One of the problems we run into with a number of clients is we have medication that we send home, but how do we give those medications? And so we're going to go through some basic steps on medicating your dog. And one of the things that you really ought to be paying attention to would be, one is how used is your dog having its mouth handled? And so, one of the things we'd certainly test is, one, can you open your dog's mouth? How much pressure? And you can notice that Indy puts a lot of pressure on my fingers. And I didn't introduce Indy, but I better do that right now. This is Indy, and then this is her owner, Jolynn. There we go. So anyway, in assessing that, what I'm going to do is just let Indy tell me how well she's going to let me open her mouth, and she'll actually let me open her mouth. And so what we'll do, looking at some different options as far as pilling goes, we do have a product called Pill Pockets, and Pill Pockets are actually a very tasty treat that actually has a center that it's easily placed with medication in and then pinched off. And so that hollow center allows meds to be placed in that location. A lot of dogs will take these as a treat. There are a few cases where these treats may not work well with the medication that we're using, such as thyroid medication. That probably should be given individually by itself. But Pill Pockets give us a good option. The other options when we're having to medicate, essentially are pill guns. And pill guns have typically a very soft tip that allows introduction of a smaller pill. It's limited by the size of the actual pill gun, or in some cases a little stiffer, essentially tentacles to hang onto the pill. And those are loaded and then placed, in the back of the throat. And so we're gonna actually start and kind of go through real quick and just show you in medicating that. What we'll do with Indy is we'll get Indy comfortable. Then I'll let Indy open her mouth, and then I'm gonna place my finger clear back in her on her tongue, put pressure there, and she did real well. So what we're gonna do is, just by medicating, we're gonna give this pill, and we'll do the same thing. And then I'll place it back past her tongue and put that in the back of her throat. If we were using a pill gun, let's say, and in this case, for Indy, we're gonna place a treat in this plastic pill gun, and we'll do the same thing. And because I'm right-handed, I'm gonna switch sides. We'll come to this side. Oh, good job, Indy, good job. And then we're gonna place this in the back of the throat, give that, and then we've medicated Indy. We'll stop.